Welcome back. The second wave of COVID, it's been even worse than the first. More than 100,000 Americans lost their lives just this year. It's only February, and now we could be facing a third wave as the virus continues to mutate.
An urgent warning from experts saying the next 6 weeks are critical to stop the spread of those highly contagious variants.
Look, I'm not an alarmist, but this is as scared as I have been since the beginning of the pandemic.
The White House racing to ramp up vaccinations before the COVID variants take hold, announcing plans to ship 1 million doses of vaccine to 6,500 pharmacies starting next week.
Due to the current supply constraints, this will be limited when it begins, making sure that we are picking pharmacies in that first phase that are located in areas that are harder to reach to ensure that we have equitable distribution.
The vaccine rollout gaining speed, but this morning, less than 8% of Americans have gotten the vaccine. In Texas, thousands are overdue for their second doses. Some people just aren't showing up for them, slowing down vaccinations statewide.
It's just logistically hard because they either have to find a ride or it's a day that may not work for them.
As Super Bowl weekend looms, fears the game could become a super spreader event. The CDC issuing guidelines for the big game, warning against attending large gatherings, urging people to watch at home with your own household. The mayors for Tampa and Kansas City even issuing a joint PSA to address in-person celebrations.
I encourage everyone to celebrate in small groups instead of squeezing into a crowded bar.
Order takeout from your favorite local restaurant.
And of course, don't forget to mask up.
Now let's bring in our guest, Dr. Ricard Besser. He's the former acting director of the Centers for Disease Control, the CDC. Currently, he's president and CEO of the Robert Wood Johnson Foundation. Thank you for joining us, Doctor. The president's COVID task force is warning that the next 6 weeks are going to be crucial to stop this thing from continuing to spread. We've got new variants popping up. The vaccine rollout has been a little bit slow. First of all, do you agree with that assessment? And what more could be done to stop this thing from continuing to spread?
Well, I do agree. These next 6 weeks will be absolutely critical. We're seeing some trends in the United States that are encouraging. The number of cases in every state is going down. The number of people hospitalized each day is going down. That's very encouraging news. And we're seeing vaccine rolling out, increasing number of people being vaccinated each day. All of that I find extremely encouraging. There are a number of things, Larry, though, that are also challenging. One is the fact that we are starting to see more of the variants, the strains of virus from different parts of the world appearing here in the United States. And over time, we'll see how widespread they become and whether people who have been infected with the strain that has been in the United States will have protection against those strains. And then the other piece, Larry, that I think is critically important is that while the number of people getting vaccinated is going up, many of the people who are at the greatest risk, frontline workers, people working in our supermarkets, driving our buses, in our food supply, the teachers who are teaching our children in school, a lot of these individuals are not in the groups that are getting vaccinated around the country. And so I worry, especially as we see such disparate rates of infection among Black, Latino, and Native Americans, I worry that we're going to still see a large number of cases among those people who are out there keeping our economy going.
And speaking about some of those communities of color that you were just referring to, the Robert Wood Johnson Foundation, of course, you're heading up that group now. You just released a brief that spells out some of the devastation that this virus is causing, especially with those communities of color. And we all know about that. That's been in kind of the zeitgeist. But this thing is also causing a housing crisis that was bad already. And I know that your group is doing a study on that. Could you tell me all about that?
Yeah, I mean, so people ask, why is the Robert Wood Johnson Foundation, the nation's largest philanthropy focused on health, talking about housing? And the reason we are is that it's absolutely a critical piece if people want to have the opportunity to live a healthy life. You have to have access to safe, high quality, affordable housing in communities that allow health to thrive. We know in this COVID pandemic, it's making worse a housing situation that has plagued our nation for decades. And that is the fact that for millions of people, they face on a daily basis the threat of eviction. The administration has now extended the moratorium against evictions. It's extended until March. It's very challenging to access that. It puts a lot of weight on the tenant. We truly believe that there should be a broad ban on eviction and foreclosure that goes until at least 3 months after the end of the public health emergency, so after the pandemic is over, and that the government takes steps to cover back rent. Right now, the total is about $60 billion in back rent. But unless there's some movement by the government to provide the dollars to landlords, it's just kicking the can down the road. And when the moratorium is lifted, we will see just a wave after wave of evictions across this nation.
The COVID task force, the president's task force, just announced that it's sending more than 1 million doses of the vaccine to pharmacies. Thousands of pharmacies, I think it's 6,000 or 7,000 of them. Do you think that's going to make a dent in trying to get more shots into people's arms?
Well, what I hope, Larry, is that will get shots to people where they are. One of the big challenges in what the government is trying to do is how do you quickly and effectively vaccinate everyone in America, especially at a time when there's not enough vaccine. So if you're not clear in stating that for quite a long time, the number of people who want to get vaccinated, need to get vaccinated, is going to far outstrip the amount of vaccine we have. And that people will be prioritized based on a number of factors, based on how likely it is that they would have a really bad outcome and potentially die from COVID. And most importantly, the likelihood that they're going to be exposed to COVID and could transmit that virus within their homes. Those are really critical factors here. And by putting it into pharmacies, hopefully what it will do is bring the vaccine close to people, bring the vaccine to a site that is trusted and known to many people. But by opening up thousands of pharmacies for vaccination, it has to be made clear, very clear, that it doesn't mean that the vaccine supply is increasing dramatically, because that is going to take time. Manufacturers can only make a certain amount of vaccine at a certain rate. But what it will do is bring vaccine hopefully to many people who need it. Because right now we see major disparities in terms of vaccination rates, where Black, Latino, and Native American individuals who are at the greatest risk of hospitalization and death have some of the lowest rates of vaccination across the country.
Even after a year and all the devastation that we've seen from this thing, there's still resistance to the vaccine. A bunch of nut jobs actually shut down LA Dodger Stadium, their vaccination site, over the weekend. So how big a challenge is that? The people that just are not listening to the science, they're the anti-vaxxers, and they're actually protesting and scaring people from getting it.
There is a real challenge, though, that there's a lot of misinformation out there. A lot of people are getting information that's coming from untrustworthy sources, that's not true to the science, that's raising false concerns. That's very different from people who say, hey, I want to wait a little while. I want to see a little more information before I'm comfortable getting vaccinated. It's important that you respect people and you listen to people's concerns, and that you provide resources to groups that are trying to reach people in the community, trying to reach people in communities with trusted voices. And in different communities, what you find are different voices are trusted. So it will be very, very important that we ensure that people get science-based information, factual information, so that everyone can make an informed decision, truly informed, based on facts, as to whether they want to get vaccinated now, whether they want to wait a little bit. That's very important.
Finally, doctor, COVID fatigue. This thing has been going on for a year. People are sick of wearing masks. I'm sick of wearing a mask, but you got to wear a mask. It's the right thing to do. Stay away from each other. Is that one of the big challenges as we try and get rid of this thing, just having people continue to be diligent?
It is. If we let up now, when the end is really in sight, when there's enough vaccine around the country, we are going to be able to change our lives and get back to being with the people we love, hugging the people that we love, getting back to doing the things that we really enjoy. But if we let up, if we let down our guard, if we take off our masks, if we don't respect the fact that we all are responsible, not just for our own health, but the health of everyone in our community, if we let up, we could be in a very dangerous situation, especially as new strains circulate around the globe, strains for which many people have no protection.
Thanks for your time, doctor. Appreciate it.
Likewise, thanks for talking with me.